Hi guys, welcome back to my YouTube channel. If this is your first time coming on my channel, I'm Blessing. I'm about to be a nursing student bestie. Go ahead and click the subscribe button because you would love it here. I put 2 videos out weekly and we break down nursing concepts. We talk about nursing stuff, okay? On today's video, I'm going to be talking about peripheral vascular disease, also known as PVD, okay? So we know that this is caused by atherosclerosis and arteriosclerosis. God, it's such a tongue twister, okay? Now, arteriosclerosis, which is the ATH1, it's caused by a deposit of like fat fibrin. It's fibrin that obstructs blood flow in the arteries. While the arteriosclerosis is the thickening of the vessel, so it leads to like loss of elasticity, basically making blood flow harder, okay? And we know that when blood is not flowing, the body is not getting oxygenated, and this is a problem, okay? Now there is going to be something wrong with the lower extremity, which is like the legs. So the older, the more risk, and this happens mostly to the African Americans. Like, we have so many things wrong. Oh my gosh. Risk factors include smoking, hypertension, high cholesterol, family history, being overweight, physical inactivity causes this. It causes arterial ulcer, okay? So now, what are clinical manifestations? What are things you might see that makes you know, this person has PVD? You might see pain. This person would actually have pain, intense pain. Guys, we would also talk about CVI. Or CVI, you might see like less pain, like more mild pain compared to PVD. But yeah, we'll talk about that in another video. But in PVD, this person is going to have pain even at rest, okay? This person is going to have intermittent claudication. That leg or the extremity is going to be cool to touch. There's going to be diminished pulses in the affected region. There'll be diminished sensory, so like atrophied muscle in that particular extremity. The person is going to have skin discoloration. When the legs are elevated, the legs will be pale, and when the legs are dependent, the leg is going to be dark red. The person will have thick skin, shiny, hairless skin, because there's going to be skin disorders basically. Then this person is going to have thick toenails. Now, how do we diagnose PVD? So they could do the Doppler ultrasound studies. So it's like a more intense pulse assessment of the extremity, kind of like an ultrasound. They could also do angiography. This is where they go in to view the obstruction. Treatment for PVD includes revascularization. They take a good vessel from one part of the body and they bypass the bad vessel in the lower extremity. So this is revascularization. They could also do endarterectomy, and this is where they go in to clean out that vessel. It's kind of like scraping it, hopefully to open up the vessel. They could also do non-surgical procedures like percutaneous transluminal angioplasty. So like they go in with a balloon, like a cardiac cath to the lower extremity. They blow up that balloon to kind of open up the vessel. Then they may leave a stent in there. You know, I'm gonna put a picture of a stent so you see what that is. So this like opens up the vessel so that blood could flow. Then we should encourage them to stop smoking, exercise regularly to promote circulation. Encourage them to walk. Even if they have pain, don't stop walking. When claudication is present, rest is usually encouraged. And then control things like diabetes, hypertension, hypercholesterolemia, and obesity. You know, the core morbidities. You could also use like pharmacologic therapy, meds like Plavix, Pletol, Trentol. These meds would inhibit platelet aggregation and they would increase blood flow to those extremities, hopefully to improve that claudication, because we gotta do what we can to help this patient. Okay, so that brings us to the end of today's video. Don't forget to give me a like, kindly subscribe, and leave comments. I'll see you in my next video. Bye.